So this is Gabriel Long. We're going to do an assessment here on Dallas. We're going to start with observation. We're going to look for swelling, edema, any pimples or moles, anything that might interfere with our reading on the nervous scope. See some swelling right through here and right through here as well. So we're going to go to instrumentation. We're going to turn the nervous scope on. We're going to set the prongs just wide enough to reach the lateral aspect of his neck here. We're going to start at T2. We're going to work our way up the spine. We're going to be looking for a break. If we see a break, like we do right here, we're going to trace over it 3 times to confirm. We'll go one more time. We're going to mark it on the trailing edge of the nervous scope there on the reading on the side of the break. We're also going to work our way from T2 down the spine now. Looking for any breaks. We have a break right through here, so we're going to trace it 3 times. Mark it on the trailing edge. Work our way aggressively down the spine. Okay. We're going to rock out some static palpation. We're just going to feel for any edema, swelling, and also pain on pressure. Is any of this painful?
No.
Okay, we're going to work our way down the spine here. We do have some swelling right through here, mid-thoracic area, and then right through here on the left side as well. Okay. So now we're going to go to our motion palpation. We have the lumbar spine. You go through here. We're going to go with L3, L4 here, or L2, L3. I'm going to have the patient cross their arms, and we're going to have them extend back, flex and extend back, trying to find a segment that's not closing down. Right here, at the L3 area, it's not closing down. So we're going to rotate. There's no movement going to the left there. Let's go to the right. And it's moving. So we know we have a PL because we're not moving to the left. So we're going to laterally flex as well. And no movement. So go to the right. So we have a PLS right here. Okay. So now we're going to go to our pelvis, if I can have you stand up. Come over here. I'm going to find his PSIS. I'm going to have you bend over. As you can see, his left side is moving with his spine. If his right side were to catch up at the end, we would know it to be a sacral issue, but we know our issue's on the left now. The left side is catching and moving up when he bends over. So I think we have a glute height. So what we're going to do is we're going to assess the height of his glutes here. And the left side is obviously higher here. That tells us we have an 8S ileum here. And then I'll have you sit down. We're going to assess rotation. We're going to have the patient internally and externally rotate his knee here. It's not closing down. It should be moving medially. It should be closing down medial here, and then we move lateral. Move his knee lateral. So if he's not moving internally, must be stuck in external rotation. So in his ileum on the left side, he would have an AS E ibis. There we go. Thank you.